Thank you for tuning in. This is Johnny from Green Healthcare. Today we're going to talk about dental implants and what you should do when you choose to do a dental implant, whether you use our service or somebody else. When you're choosing to do dental implants, there's things that you should need to prepare for. Not only to stop smoking and drinking, but also mentally know that when you're doing dental implants, that factors that take into consideration. Sometimes a physician in the States or in Europe says, you know, I need a dental implant. But sometimes they say, okay, you need a dental implant because they think they can't see. And make sure when you're doing it that you've done a 3D scan to make sure that in fact your bone structure is ready for that. Sometimes the people with diabetes, their bone structure is weak. Sometimes you need a greater bone graft. Sometimes you need a small or large bone graft. The other thing, you might have to raise your sinus. Why do you have to do this? It's so it's elevated and it's level, so when the implant gets put in, it's level. This helps in the future, so when you bite, between your circumference, between the bite, the top and the bottom, when you bite down, you have enough room. This is important, but people sometimes don't take that into consideration. This is important also, that infection. Some people want to come in and do implants from one day to another and go back home. This is the wrong thing to do. What happens, no matter whether you're in the States or in anywhere you're at, you can get an infection. Infections particularly happen between the 3rd and 5th day, if it's going to happen. Sometimes a little bit later, but it tends to happen in those days. So my suggestion is when you do your dental implants, you stay 7 to 10 days. All right, this is a little bit of information. I hope it was beneficial for you. If you have any questions or comments, please leave them at the bottom and we'll take on this topic. Pura vida.